Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Hematuria. Introduction. Hematuria is blood in the urine. There are two types of hematuria. Gross hematuria is blood that can be seen in the urine. Microscopic hematuria is blood that can only be seen in the urine with a microscope. Hematuria is not always a cause for concern. Too much exercise and drugs like aspirin can cause it. Sometimes, though, hematuria may be a sign of a serious problem. This program explains hematuria. It talks about the symptoms and causes of the disorder. It also explains how hematuria is diagnosed and treated. Urinary tract. The body uses the urinary tract to remove waste and extra water. The urinary tract usually includes 2 kidneys, 2 ureters, a bladder, and a urethra. The kidneys are a pair of organs. Each kidney is about the size of a fist. They are located below the ribs. There is 1 kidney on each side of the spine. Urine travels from the kidneys down 2 narrow tubes called the ureters. The urine is then stored in a balloon-like organ called the bladder. It is emptied through the urethra. The urethra is a tube at the bottom of the bladder. When the bladder empties, a muscle called the sphincter relaxes. Urine flows out of the body through the urethra. In women, the urethra is very close to the opening of the vagina. Symptoms. There are 2 types of hematuria: gross hematuria, microscopic hematuria. Gross hematuria is blood that can be seen in the urine. Red blood cells can cause urine to look pink, red, or brown. If gross hematuria is caused by blood clots, it may be painful to urinate. Microscopic hematuria is blood in the urine that can only be seen with a microscope. It often has no symptoms.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. People with hematuria have kidneys that allow blood cells to leak into urine. This can have many causes. Common causes of hematuria include intense exercise, sexual activity, some infections such as a urinary tract infection or UTI, some viral illnesses such as strep infections and sexually transmitted infections, trauma. Sometimes hematuria can be caused by something more serious. These causes include blood clots, blood clotting disorders such as hemophilia, inflammation of the kidney, urethra, bladder, or prostate, kidney or bladder cancer, polycystic kidney disease, sickle cell disease. Bladder and kidney stones can cause hematuria as well. The minerals that are passed in urine can form crystals in the kidneys and bladder. These crystals can turn into small stones that can be painful to pass. Things other than blood can cause a color change in urine. Beets, food dye, and some medications have been known to change the color of urine. This is rare. Risk factors. Anyone can have hematuria, but some people are more likely to have it than others. Men older than 50 have a greater risk of having hematuria. This is because the prostate gland slowly grows larger as men age. An enlarged prostate increases the risk of hematuria. People who have frequent kidney or bladder stones are likely to have blood in their urine. A family history of kidney or bladder stones can also increase the chances of a person having hematuria. People who take medicines like aspirin or antibiotics may be at risk for hematuria. Diagnosis. A healthcare provider will ask you about your symptoms. They will talk to you about your medical history and perform a physical exam. Your healthcare provider will test your urine for blood. This test is called a urinalysis. You will be asked to provide a urine sample. You will collect your urine in a sterile container. Your urine may be tested in your healthcare provider's office, or it will be sent to a laboratory for testing. Your healthcare provider also may perform a blood test. This can check for signs of kidney disease. People with hematuria often need imaging tests. Imaging tests take detailed pictures of your organs. Imaging tests may include ultrasound, CT scan, magnetic resonance imaging or MRI. An intravenous pyelogram or IVP is an X-ray of the urinary tract. A special dye is injected into a vein in a person's arm. The dye travels through the body to the kidneys. This makes urine visible on an X-ray. The test can help find problems that can cause hematuria. Your healthcare provider may choose to perform a cystoscopy. A cystoscopy is a procedure that places a small tube and camera into the bladder. This allows your healthcare provider to examine your bladder and urethra. Hematuria also can be diagnosed through a kidney biopsy. A kidney biopsy is a procedure that takes a piece of kidney tissue from your body to be examined. A biopsy may be done if a healthcare provider believes that kidney disease is the cause of hematuria. Treatment. The treatment for hematuria depends on its cause. If there is no cause found for hematuria, it may not be treated. Antibiotics can be used to treat an infection that is causing hematuria. Prescription medication can help treat an enlarged prostate. Prevention. There is no way to prevent hematuria, but the causes of hematuria may be prevented. Drinking a lot of water and practicing good hygiene after urination can help prevent urinary tract infections or UTIs. Certain feminine hygiene products can cause irritation that can lead to a UTI. Drinking enough water can also help prevent kidney stones. Kidney stones can cause hematuria. You should stop smoking if you smoke. This can help prevent kidney and bladder cancer. Exercise and a healthy diet also can help prevent these cancers. If a person's hematuria is caused by intense exercise, changing the exercise routine may help stop hematuria. Sexually transmitted infections, or STIs, can cause hematuria. Safe sex practices, such as using a condom, may help prevent STIs.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hematuria is blood in the urine. There are two types of hematuria. Gross hematuria is blood that can be seen in the urine. Microscopic hematuria is blood that can only be seen in urine with a microscope. Hematuria is not always a cause for concern. Too much exercise and drugs like aspirin can cause it. Sometimes, though, hematuria may be a sign of a serious problem. Common causes of hematuria include intense exercise, sexual activity, some infections such as a urinary tract infection or UTI, some viral illnesses such as strep infections and sexually transmitted infections, trauma. Sometimes hematuria can be caused by something more serious. These causes include blood clots, blood clotting disorders such as hemophilia, inflammation of the kidney, urethra, bladder, or prostate, kidney or bladder cancer, polycystic kidney disease, sickle cell disease. The treatment for hematuria depends on its cause. If there is no cause found for hematuria, it may not be treated. Thank you for using Explain.